So thank you all for joining us. My name is Amy Allen, and I'm Vice President here at the WCA. And it's my pleasure to welcome all of you to the third and final episode of our Summer Cyber Series presented by Anatomy IT. The first session addressed recent changes to cybersecurity and how to protect your organization. The second session spoke about AI and how it's used by attackers and defenders alike. Both of those webinar sessions are available on our website and YouTube channels. Today's session will delve into the implication of a code dark in healthcare and the lessons all businesses can take away from what healthcare organizations do when or if they are unable to use their systems due to a data breach or ransomware attack. You'll hear a real-life case study that I am sure will send you running to a cybersecurity expert like Anatomy to make sure you stay protected. I also want to remind everyone to register for Converge, the region's first ever digital innovation conference that we are hosting in partnership with Westchester County and the STEM Alliance. This is a live event taking place on October 1st with multiple speakers and panels, and all the information is on our website, which is westchester.org. Just a couple of housekeeping items. All participants are in listening mode only. If you have questions, please put them in the chat and they will be monitored throughout the discussion, and we'll get to as many as we can. You'll also receive a recording of today's session to the email that you're registered with. It's certainly now my pleasure to turn the program over to our moderator, Jim Tufts, Senior Director of CIO Services at Anatomy IT. With over 40 years of IT experience, including 20 plus years in healthcare, Jim has successfully guided clients through CIO engagements, leveraging his deep knowledge and experience in cybersecurity, value-based reimbursement, and healthcare IT best practices. Jim's presentations at prestigious conferences and leadership forums demonstrate his commitment to empowering healthcare organizations to thrive in an ever-evolving digital landscape. So now, Jim, take it away, please.
Well, thank you, Amy, for that wonderful introduction, and welcome everybody to the session this afternoon. And I think we've got a lot of great information that will be exchanged here, and we certainly want to make this something that you get value out of as well. So, please author up some questions if you've got them, and we'll note those, and there'll be a time at the end for a little bit of a Q&A. And so, looking forward to this session this afternoon. And the first thing I want to do is introduce our speakers. We have Nicole, Robin, and Tony, and I'm going to have them kind of provide a little bit of a bio for themselves to kind of kick things off here. So Nicole, why don't you get us started?
Sure. Good afternoon, everyone. I'm Nicole Ziogas, and I'm a senior project manager at the Greater New York Hospital Association, working on our emergency preparedness team. Just a little brief background on Greater New York. We're a trade association based in New York City, and have hospital and continuing care members across New York State, Connecticut, New Jersey, and a little bit of Rhode Island. And within my job, I do a lot of emergency response and preparedness activities for our members, but a lot of my work is focused on cyber and how cyber impacts our members. And we recently released the Cyber Disruption Toolkit, which will be shared with you all today. But I'm excited to be here with you all today to talk cyber.
All right, thank you, Nicole. Robin?
Hello, good afternoon. Delighted to be here. My name is Robin Thornton. I am a security engagement and education specialist at Memorial Sloan Kettering Cancer Center. A little bit of background on MSK for those of you not aware. Northeast Maine Specialist Cancer Care Center and research institution. We regularly rank in the top 2, along with MD Anderson in the country for cancer care. Myself, I have about a decade of experience in the IT field. I spent the first 5 years or so in general IT project management for some of the Europe and the US's big banks, but I saw an opportunity to transition into cybersecurity and haven't looked back. I really enjoy the people-focused aspect of cybersecurity as opposed to the technology side, and for me, it's all about simplifying cybersecurity for those who find it daunting, so that they're better equipped to reduce their own cyber risk and that of their employers or their business. Outside of work, I have been spending the last few months trying to get a cybersecurity podcast off the ground. Feel free to ask me for that link if you would like. But when I'm not recording or editing, you can normally find me watching some Premier League football. My club is Manchester City.
All right, very well. And Tony.
Good afternoon, all. My name is Tony Palacco. I'm the Regional Vice President, Associate CIO for WMC Health. I also am the CISO for the health system. We are a regional health system here, Westchester Medical Center. Most of you might know us as Westchester Medical Center. We have 9 hospitals and 2 physician practice networks in our network. I've been with WMC for a very long time. I'm making 29 years in November. I started here in IT, grew in the ranks. I ran operational IT here for many, many years. And in the past 7 to 8 years, I've taken up a role in running the information security management program for WMC Health. And I have been instrumental in building the cybersecurity program, managing vendor relationships, and IT security strategy in general. So we also had a cyber event that we experienced a year ago. So later on in the segment, I'll be glad to share some of the insights, what we learned, what we lacked, and all that. But glad to be here. Thank you.
Great. Thank you, panelists, for your introductions, and we'll just dive in here. So our session today is really kind of focusing in on Code Dark, and we'll get a little bit of a better understanding of what that is. We'll take a look at actual actionable, that's a hard word for me to say right now, incident response plans and how you can get those in place and practice those before an event actually occurs, and then some steps to do to ensure that your data security and integrity is maintained, not only prior to, but after an event as well. And so those are kind of the things that we're going to dive into. And as mentioned earlier, we'll hopefully have time for a question and answer session at the end. And so kind of jumping into that first piece, what is a Code Dark situation? And I want to preface that just a little bit with just some statistics that kind of, we always like to throw out some of those to kind of set the stage for the discussion. And I wish I could sit here today and tell you that we're seeing a vast decrease in ransomware and cyber incidents. Unfortunately, that is not the case. As we hear all the time in the news, in the periodicals and the emails we get from a number of different sources, that those continue to be on the rise as we improve the tools, the threat detection solutions and those kind of things. The threat actors only get better at what they do, right? And as we're utilizing AI in a lot of our systems, so are the bad guys, right? And so it's becoming just an ever-present threat that we're going to have to navigate here going forward. The Cyber Threat Intelligence Integration Center released some statistics from 2023. And they said there was indicated there was a 128% increase in ransomware events in last year. That compares to, we had 113 that affected healthcare in 2022. That number jumped to 258 in 2023. And those, again, are the ones that are reported, right? And so there's always that piece we have to keep in mind with statistics, is that a lot of these, especially in the smaller end of the scale, go unreported, right? So these are just the things that we know about. Health and Human Services, the HHS, reported 468 ransom incidents in healthcare and the public health sector last year. And really, to me, just a staggering statistic here that really kind of underscores, what any organization is up against these days. But Statista reported there were over 317 million attempted ransomware attacks in 2023, with just over 5,000 of those being successful, right? And so that's across all industries. So, if you're here today and you're not part of a healthcare organization, but you're looking at, how to protect your organization, your business, 317 million attempted attacks is a staggering number to me, right? So you can look at the number that were actually successful and say, well, hey, we're doing a pretty good job, right? But the ones that are successful can really wreak havoc. Not only in your organization should one occur to your company, but even partners, vendors that you work with, right? We've seen some over the last year where vendors were hit that affected um, hundreds of organizations that use them as a service or use their solution, right? So it's not just hitting your, a cyber incident that occurs in your organization, but also ones that you work with. And so I think the first thing to probably do is to really understand what is a code dark and kind of how it impacts you. So, Tony, I'm going to hand it off to you first, and if you would kind of give us an insight into code dark. And I know you've got some experience with that at your organization that you're, have agreed and are willing to share with us today as well. But just explain a little bit about what is a code dark, and what you've learned as an organization from your experience there.
Sure, Jim. So code dark in healthcare refers to an emergency protocol that's activated in response to a significant cyber event. It could be a ransomware attack. It can be a malware event. It could also be a denial of service attack against a healthcare org. So when a code dark is called, it signals all the staff to take immediate action to protect the hospital's network and data. This would include disconnecting workstations and internet-connected devices and awaiting instructions from the incident response team for containing an event while it's being validated. This protocol would ensure that everyone from nurses to surgeons becomes a cyber first responder, helping to contain the attack and minimize its impact on our patient care. So first, an interesting observation about code dark that I was thinking about is that in healthcare, we have examples of how we train our workforce for race. I'm sure many of you might know for fire events, right? Rescue, alarm, confine, extinguish, or pass for a fire extinguisher use, pull, aim, squeeze, sweep. Similar to that, DARK could align well with such an acronym where we are preparing the staff to make sure that in the event of a cyber event, we can contain it and minimize the impact to patient care and the healthcare organization. The net result of a code dark is being long prepared for, right? Like not necessarily meaning a system outage. Healthcare organizations always have disaster recovery plans, business continuity plans, and we do drills to make sure that our disaster recovery systems are prepared to handle a scenario. But what is the difference between a code dark and a normal disaster recovery or a business continuity scenario is that what causes the outage, right? Normal disaster recovery is designed to handle a weather event. For example, we have a blizzard coming or a hurricane or something like that. But in the event, in case of the code dark event, it's a malicious attacker intentionally trying to cause harm and steal your data. So those are the differences that I can call out, and how we change or adapt our disaster recovery and business continuity plans to consider such an event, making sure that how we react to these events, how we train the workforce to make sure that they pick up on the cues that come up and react quickly, and let the cybersecurity teams or the technology teams take quick action so that we can minimize the impact.
All right, very good. Thank you, Tony. I think, as you mentioned, there's varying degrees of cyber incidents, right? And some of them are maybe contained within a somebody just gaining access that shouldn't, to the network, but no harm was done to the point of where they're wiping out your systems. holding them ransom and basically rendering them useless to the organization, right? So there's varying degrees of that. And I think you've got to kind of recognize that in your preparations and in your responses to that. And I think, there are long-term effect of those based upon how, how extensive they are. I think it's been reported that the average, data brief life cycle in healthcare is about 330 days, right? And that's from the time of discovery until you get systems back up and running, until you go through all the forensics to figure out what was maybe potentially impacted or disclosed, and then how you, notify public and help with, credit reporting and those kind of things. That's a pretty extensive exercise from a really a ransomware event, and so it can have quite a bit of an impact on your organization. So Tony, you mentioned earlier that you experienced one. Can you give us a little bit of a insight as to what that event was, how it kind of came about, and how your organization reacted to it?
Sure. About a year ago, it was actually in the October of 2023, right? It was a normal week, and our security team picked up some indications of compromise to a privileged account. So we have systems deployed that is looking at file access and privileged access all the time. AI-driven systems that would shine a light to a potential compromise. Such an alert was received in early October, the second week of October, and we immediately reacted to it. Right? Like we started investigating, and we came to a conclusion that a threat actor has compromised an account, and they were testing things out, or we saw indications of data exfiltration that was happening. Fast forward 2 days, we received a note from the threat actor saying that they have compromised our systems. So we had taken some preventive measures immediately after learning of the potential compromise. So what we have done was that the save and grace for us was that a month before the incident in October, we had done an incident response tabletop exercise that participated all parties involved, and we had a drill. We simulated an incident and collected feedback on how the respective people should be reacting to an event. This was super helpful. It organized the team. We had developed an incident response playbook. We immediately followed our playbook and started following documented processes that was part of our incident response plan. To name a few things that we did, once the compromise was confirmed, immediately we put that hospital campus in an island mode. We disconnected or unplugged the hospital from the internet and to our other campuses. So that confined the threat within that campus. We also made sure that the systems that we were known to have some compromises were shut down immediately. The second thing that we did was that WMC maintains an incident response retainer with an incident response company that we have contracted with. Immediately they were engaged and they started a forensic investigation. Parallelly, we communicated to law enforcement. We notified, we submitted an IC3 incident. We contacted the local FBI field office and as well as CISA. We engaged our cyber liability insurance carrier, and they started their own protocol on how to react to an event like this. So everyone collectively working together and having the experience from the tabletop that we had done tremendously helped us. And the investigation progressed. We slowly started identifying more and more systems that were compromised that had to be rebuilt. The IR retainer company that they helped us with some of the rebuild efforts. The insurance carrier brought in resources that we needed. External legal counsels were engaged to help us, advise us on how to proceed and react because they had a lot of experience dealing with events like this. So it was definitely an eventful October that I can tell you guys that the after effects of that still continuing with our compliance risk departments and our legal departments, right? It's we have learned a lot. We have improved our incident response plan based on all the lessons that we learned, and it is a constant learning experience. But we managed. We came out of it. We rebuilt. For us, it was more a data exfil kind of a scenario, not necessarily an encryption. So we have done a lot more things post event to make sure that if it was an encryption kind of an event, how do we recover from it? We have invested in cyber recovery vault, a vaulted backup system, to name some. Anyway, that's my experience, Jim, and I can go into a lot more detail, but in the interest of time, I will give it back to you.
All right, thanks, Tony. I think it's important what you mentioned is that they had had plans and playbooks and things like that in place that they followed, right? And they had reviewed those and practiced those ahead of time. We met last week to kind of discuss this session and kind of get organized on it, and I thought back to when I was in grade school, right? And we used to do the fire drills at school, right? And so they would conduct those every so often, and you'd understand as a child, right? When that fire alarm goes off, what you should do, right? And so the reason they did that, right, was so that if there ever there wasn't panic, there wasn't confusion, everybody knew exactly what to do, and they drilled it, right? So the same kind of thing, really holds true for a cyber incident. And Tony mentioned they had the incident response playbook that they pulled out and followed. So I think from that you want to make sure that you have actionable incident response plans in place. So Nicole, could you kind of walk us through what is an incident response plan and what you should include in it?
Yeah, so I can think we could start at a very high level and then kind of move more specifically into cyber. But incident response plans are basically a document that organizes your institution in case of emergencies. And how hospitals tend to do it is at all hazards, but they don't tend to just focus on one kind of emergency. Hospitals face emergencies from flooding to heat, cyber, whatever you can think of, pandemics. There's probably an emergency for any kind of disaster you're thinking of. So and it tends to outline, who your incident commander is. So who's actually leading this response? And I think that's a really important, like who's in charge, who is that person? And then you have things like operations, who's dealing with other like logistics. There's other different areas of an incident response plan, but it's also how do you contact these individuals? Who are where do you find them? Because sometimes also emergencies don't exist during a 9 to 5 schedule. They exist, they happen at 1 o'clock in the morning. And so how do you get in contact with, your departments that you need to talk to at 1 o'clock in the morning? It also, talks about your available resources. What can what do you have available? What are your critical devices that you have, and what is that to your organization? And it really outlines a long list of things. And for healthcare, it's a very complex, ever-evolving document, as Tony mentioned. It's an ever-changing document. You learn from the lessons from other emergencies, you learn from other sectors, so it's not a stagnant document, and it always should be updated and constantly reviewed. But it really is like your guidebook to an incident, and it should be kind of you can always focus it on specific incidents, but having a very broad look and all incidents at all kind of incidents is a really important aspect of these plans.
All right, very good. The plans themselves are necessities, right, to have to be able to follow. But could you touch a little bit on kind of what proactively you can do, with the plans or in concert with the plans? How do you approach that from an organizational perspective?
Yeah, so I can say for hospitals, each year they conduct a hazard vulnerability analysis, and it really tackles about all of the hazards that they face. And so that's where they kind of base their incident response plans, how it changes, how what stays the same. Going really, and I can dive a little bit more deeper into cyber. So Greater New York released a cyber disruption toolkit, and more than happy to share that with anyone. But what those kind of look like of cyber specifically, there's a lot of different prongs that approach it. So thinking about how you communicate with others when you don't have access to your communications, how do you who's responsible for what? How do you continue patient care? And I think what we try to tackle is, patient care is hospital's main priority, is continuing that throughout a course of any emergency, especially a cyber disruption. So tackling that is really important. So, they're always a constantly evolving document. You're thinking about who you're contacting externally. Tony mentioned about all of the contacts that he had during his when they had their experience. So who are those individuals? And it can be very complex, but with this toolkit, we do try to provide actionable documents and tearaway pages. And while intended for hospitals, it can really be one-to-one to a lot of other organizations. And I thought of, when I was prepping for this panel, I thought of like a law office. So if a law office experiences cyber disruption, so how do you communicate with your clients? How do you communicate with the courts? Do you have backup of your legal documents in a place where it's not, most legal documents and most things are on your computer now. So do you have, a computer that's off your network that has all of your documents, so you can still continue your processes for your clients? And so what are those backups? How do you communicate? And do you have paper? I think that's like one thing I've learned over the course of this, is that going to paper and pens is the access to actual paper and pens. So many, like, having enough paper and pens to write a document is like, you think about it and you're like, oh, that makes a lot of sense. But that is something that, we've heard constantly. And a big challenge of healthcare is a lot of young nurses and clinicians, they don't actually know how to write a paper chart. So, thinking about it in your field and what you do is really important, of like, how do you do these manual processes? And that's something you can really think about in an incident response plan, is like, all right, so what is dependent on a network? And so how do I work around it? So you should find out these contingencies, and, it can be a lot of things, but I always point out the paper and pens, because you don't really think about it. And then all of a sudden you don't have paper, you don't have a computer. And so, writing down a document can be somewhat challenging.
Yeah, I think Nicole, you also mentioned, some of the organizations or groups you might partner with in helping you along the way, right? And I think maybe, with you and Tony chime in here as well, with your experience at the event that you had, what role does a partner organizations play in this, and how do you how do you lean on them for assistance or for guidance in some of these situations?
So as Greater New York, we are the partner that many hospitals lean on in a sense of this. So we do a lot of assistance, but I think what I like to take away from a role of partners and a more of a preparedness aspect is the role of what we do at Greater New York is basically the convener of groups. So we convene our chief information security officers and chief information officers bi-monthly to discuss prevalent issues to cyber. And I think that can be kind of used across sectors, as well as being able to sit in, especially like discussions like this, to be able to learn from one another, because you're only as strong as your weakest link. And when one person's affected, everybody else is affected as well. So I think that's something that we try to push, is that as cyber disruptions are going to continue to increase, it's, not about not if, but when. So it's really meeting with your colleagues, discussing what relevant threats there are to you, and learning from one another. I know hospitals constantly learn from other sectors, because we're not, no emergency is immune to one sector. So it's constantly learning from one another, and I think just continuing these conversations are really important in the future.
Yeah, I think Tony, you mentioned, the cyber insurance carrier, right, and their team, and they'll typically have involvement in a situation like, a code dark or any cyber incident, and they've got their teams that they depend on. Speak a little bit to that as well from a partner perspective.
Sure. So having the right partnership in place in anticipation of a cybersecurity incident is our key to successfully being able to respond to the event. Right? And so here at our organization, we have existing relationships with our cyber insurance carriers, with legal resources, with third parties specializing in incident responses, like our IR retainer companies, right? So when they are all documented in our IR playbook. So when the incident happened, we reacted. We had a communication manager that was reaching out to help us engage with the cyber liability insurance company. They immediately engaged with our emergency services department, while the cybersecurity team was actually doing forensic investigation internally. And with our own IR team, we were doing all these efforts, and there's a lot going on when you are in an incident, and making sure that we are organized and we have the right parties involved that would be able to take some away. So that's where the cyber liability insurance company came in for us. They brought in external resources, whether it's tech resources, security experts, and they had their own incident response company that they brought on. So we had two parallel ones going at the same time, right? So that also helped us look at what each of the IR companies were saying is the root cause or what may have happened here, to give us enough of a comfort to trust the information that was trickling in. So the partnerships are very important for us, right? It's we leverage third-party partnerships, whether to augment our security team. We also have a managed security operations center, Jim. What that does for us is 24/7, right? They are looking at all our security events, even when it's off hours for us. Their SOC is always looking at events, waking people up, making sure that they are there to react to us. And we are also a high trust certified firm, which helped us because the certification process makes great improvements to our security program, right?
All right, very good. I think one of the things that was mentioned in the discussion as well is when events like this happen, there's a lot of interest in it, right? There's a lot of angst from the organization and maybe partners, and in the case of healthcare patients, so it's important on what is communicated, right, to the outside world in an incident. And Robin, I'll kick it to you. What do you tell the outside world when an event like this happens?
It's a really good question. Enough, but not too much. And this is kind of where it comes down to, I mean, my specialism being education and training is an aspect of making sure that you are looped in appropriately with those individuals who make those key decisions, but then also in a proactive sort of sense, making sure that everybody is aware of their responsibility in terms of defending the organization from cyber events and things that might be harmful to the entity. From a what you tell the outside world sort of perspective specifically, it's enough that people feel informed and that they get an appreciation that you are being transparent and not trying to hide anything, but not so much that you fall into the realms of articulating the unconfirmed or wandering into speculation, because then that can get you in trouble. Further down the line, you end up having to walk back statements. You kind of lose credibility because you end up looking as though you kind of don't really know what you're doing. And actually, I think that goes back to a quote from the great investor Warren Buffett. He says, risk comes from not knowing what you're doing. And that's why the way I look at it in terms of my role, the education piece is so key. There's various challenges with training staff effectively on cybersecurity best practices. And probably I think the number one of those, or at least your absolute starting point, is getting buy-in, or rather getting people at all levels to care about a topic and a responsibility that traditionally they've not necessarily seen as theirs. I mean, human risk, as we term it, which is the education piece, is still relatively young. It's probably in about the last 5 or 10 years that it's really become a thing, and only in the last couple of years that people are properly catching on to it. So it's quite reasonable to assume that your typical employee considers cybersecurity to be a bit of a draconian, compliance-driven activity that's performed by IT, because honestly, historically it was. Now that might seem like a bit of a cynical position, but it's, you know, historically, like I said, it's been the realistic one because it has happened, and that will change, but it's going to take time and deliberate focus on the topic of human risk. So you really have to tap into where people have their own vested interest in terms of playing ball with cybersecurity and collaborating with it. You need to get them to understand that cybersecurity is not just a protector of business, but it's also an enabler. And those are two actual key words that at MSK we have in our cybersecurity team mission statement, because we want that sort of stuff to stand out. But from an enabler sort of perspective, you have to think about some cloud. I think it's easiest to think about some cloud computing examples, right? Remote work significantly more difficult without a cloud computing sort of environment. You're going to need VPNs, which can be sort of costly and expensive, and difficult to set up at the corporate level. Potentially, a managed device framework that says only certain machines can get to your network file shares, and that can be quite costly as well. In a cloud environment or in a cloud world, that's much more easy to do when you've got a shared responsibility model with the likes of Microsoft and Azure and AWS, Google, dealing with an awful lot of that file storage infrastructure for you, and then you managing the permissions on that. Netflix is another one. Streaming services were not really possible until cloud computing came along, because there just wasn't the availability and speed of data transfer for it. And that then also goes to sort of scalable and affordable computing. We can do an awful lot more now that we can, as technologists and as even business folk and clinicians, rent the computing space that we need for the time that we need it, without having to have a massive outlay on the physical infrastructure of that. So from that perspective, I think tapping into those vested interests, I think you've got to make cybersecurity personal. You need to both at work and at home as well. So generic practices are really only going to get you so far when you're conveying those, because people kind of become blind to them. They consider that it's just the same old 4 or 5 best practices over and over again, which kind of to a degree is. Those are the things that are going to manage you for 90%, maybe 95% of stuff. But when you start getting down to role specifics, and I'd use, for instance, finance as a specific example of this, there's a lot of times you will tell people the standard, tell your finance team specifically something like accounts payable, your standard advice with regards to phishing, not interacting with emails that have come from unknown sources, with links or attachments, things like that. It doesn't work for accounts payable. They're receiving invoices on a day-to-day, daily basis, often from people that they've not necessarily heard of before, because they might be a new vendor. So you have to tailor your advice to them and their situation. I think in addition to that as well, going to the point about sometimes these policies and controls and procedures seeming draconian, you can really help yourself with that by educating as to why they exist. People are far more likely to cooperate with you when they understand the motivations that sit behind the things that you're asking them to do, as opposed to it seeming just like an arbitrary thing that is your job.
Right. I think that's a good point. A lot of times it's like, well, IT's making us do this, right? And I saw the term just not too long ago that referred to, you can put all these technical controls and all these cyber solutions in place, to protect the organization, but somebody willingly gives up their credentials in a phishing email, and a lot of that goes out the window, right? And so they refer to like you're educating your staff as really building up your human firewall.
Yeah.
You know, and making that in context of, you know, that's your last line of defense sometimes.
Yeah, that's a good point. So there's two things that you said there. I think that are really interesting. Human firewall for one, because I think that's a great analogy. Some people don't like it. It's one of those kind of it's one of those you love it or you hate it sort of phrases. But I'm a real fan. The last line of defense thing sometimes I think if it's considered in the wrong context, it puts quite a burden on the end user in terms of saying, oh well, if everything else sort of fails, then it's all on you. And that's to an I think it's we always try and take the tack of saying to our folks, of whom there's about 30,000, we say, look, we put all the technical controls that we can in place for you as best we can and in as a user-friendly manner as we can as well, because you're talking about motivations. There's something called I think it's the BJ Fogg model, which talks about motivation versus difficulty. If you make security difficult for people, they will find a way around it, just as a matter of trying to be efficient at their job. You want to make things as easy as humanly possible for each other, but then what we try and do is we say, all of these technical controls, there's a myriad number of things that sit in front of you, but some stuff will get through. The stuff that will get through, by all accounts, might well be quite new, but it will be getting detected on a set number or a set of rules. You as the human being, in many respects, are better than the machine. You can spot weird, nuanced things that the machine won't necessarily get yet. AI probably will change a lot of that. So I try and pitch a more of an empowering angle towards people, on that understanding that they are effectively sort of the goalkeeper in that regard. The other thing that goes off the back of that, though, is for me to say, or for us at MSK to say, even if you don't catch it and something does go wrong, don't worry. This is why we have the response plans, the incident response plans. The key thing for you to do, and again, this is an education piece, the key thing for you to do is be as fast as you possibly can, or as prompt as you possibly can, in raising the fact that something went wrong, because the faster we can respond, the more we can mitigate the potential damage that goes with it, which is why we then say that, well, what we do at MSK is we publicly praise the good behaviors, and we engage, and we encourage people to be open about when something has gone wrong, precisely for that reason of fast response.
All right, great. I know we're running up against the end of our time on our session here today. I appreciate all the discussion and the input from the panelists here. Greatly appreciate that, and hopefully it was valuable to everybody. I have not seen any questions come in the chat. Amy or Jen, have you seen any at all? I have not. If you have one, please author it up. But while we're waiting, maybe just a closing thought from our panelists on just creating a culture of a security culture within an organization. Nicole, I'll let you kind of go first. How do you go about doing
that? Yeah. I feel like I'll take it from a sense of like the emergency management point of view. And with this, I always say IT is not just cyber is not just an IT issue. It's very much a patient care issue. And I think, and it goes back to Robin's point of like, it has to encompass everybody. And once they recognize that, I think that's a really important step. But I think it's constantly practicing and exercising and thinking about all the different aspects of your organization that can be affected by a cyber disruption is really important. And as I've worked through this toolkit and just talked with our members, there's a lot of things that are connected to your network. So it impacts everybody. Everyone's going to become a cyber person at some point during a cyber response. So it's kind of what I'll leave there.
All right, Tony, closing thoughts.
Well, to build up a security-aware culture in our organization, we keep the workforce informed, right? Like of the current cyber threats that are out there. So how do we do that? One, we train them properly. There are annual security training that are required as part of the self-learning modules. We include cybersecurity related content and making sure that they are aware. We have monthly phishing simulations that we send out, making sure that the different tactics that are being used out there by threat actors, that we are training the workforce. We also make sure that for every new hire orientation, we have a cybersecurity presentation that we do to the new onboarded employee, making sure that they understand the culture from a security perspective. We also send out monthly cybersecurity tips and tricks in email, right? Like, so every month that there is something going on, and whether it's from Nicole's organization or others, HISAC and others, like we would educate and send a campaign informing the staff that what are the current threats out there and what you should be careful about.
Right. Very good. Robin, any additional thoughts on education and getting the organization really focused on security?
It's a dangerous question to ask me because I could talk all day about this. I'm going to come full circle back to the piece on getting buy-in, because I think, and it's not always possible, but I think the easiest way to do the cultural change piece is really to get leadership involved and have them lead by example. I know a couple of examples where a cyber attack has happened and it was leadership were kind of sleeping on it, and after the fact they really took it by the horns and practiced what they preached in terms of everybody else. It's a matter of no member of the leadership team being held to a lower standard than anybody else. At MSK, the way we do that fostering culture piece, we've actually found that humor has been really successful. We have a Yammer or Viva Engage group community, as it's Engage as it's now called, community, and just even memes or jokes on a Friday afternoon has been wildly successful in getting people engaged and coming to the page, giving them something to look forward to on a weekly basis. But then it also makes sure that they are encountering all the other content that we are putting out, and it's lots and lots of content. Don't be afraid to say the same thing 7, 8, 9 different times, because from a learning science perspective, that's how many times that it does take someone to hear something for the message to start sinking in. We do surveys to make sure that those things are hitting the right mark. We incentivize those. We buy in goodies and stuff for giveaways, things like that. And don't even go don't go for the cheap stuff as well. Like, hype up, create your contest and things like that with various different contests on various different time frames, and make some of them like a really good exclusive piece of kit that people can only win from your information security function. We have a section on our intranet called Security at Home, where it's geared. It's not just institutional cybersecurity best practices. We say it's scams, it's what to do with your home Wi-Fi and things like that, making sure that you're secure outside of work as well, because if the messages aren't hitting at work, they might hit in your personal context, and then those sort of realms of behavior kind of cross-pollinate, and you might start bringing the good behaviors back into the workplace. I think final one on that comes down to, you also have to make it enjoyable for people, and I'm talking specifically from the perspective of feeling as though they are making progress. You make your phishing simulations or your tests and quizzes, things like that, too hard, people get demotivated. You make them too easy, it provides you a false sense of security, pun completely intended. So the science says that 85% doable, i.e. people by and large get 85% right, is just about the right kind of area that you want to be hitting for them to feel as though they know the stuff, they're doing well, but they are aware that there are things that they don't know and they will continue learning, because cybersecurity education is a continuous thing. Yes, annual testing and or annual education things from a compliance perspective and making sure that you are doing that, that's good, but really you want to be doing this continually all year round to keep it fresh in people's minds.
All right, very good. Well, I appreciate, again, from a panelist perspective, thank you for your input, your knowledge and experience on the topic today, and for sharing that with the group in attendance. Appreciate that. Thank you all for joining this session. And again, if it just in summary, kind of maybe wrapping it up here, boiling it down to maybe oversimplifying it just a bit, but it really gets down to organizing from a cybersecurity perspective, getting the right plans, incident response plans, the playbooks, those kind of things in place, and educate, train, and test those routinely, refine them as you need it, which will allow you then to execute and mobilize, not if, but when a cyber incident occurs, and maybe not panic, right? Maybe go into that with a sense that, we know it's coming, we know what to do, and let's just get after it and get it resolved, right? So again, I don't see any questions that have come in, so thank you all for attending. And I think you'll get the copy of the recording of the session, as well as the toolkit from Nicole. That's going to be included in that email as well, the link to that. So again, thank you for joining. And yeah, send us out any questions or any thoughts you have afterwards if you need a follow-up. Thanks.
Thank you.
Thank you.